Good morning. I'm Jaideep Misra. I'm one of the internal medicine doctors working with Golden Valley Health Centers for the last 3 years. And I'm here today to talk about how we all can become flu fighters. Let's talk about the complications of the flu in seniors who contract the flu. So the complications can range from milder symptoms to severe symptoms. And the milder symptoms are ear infections. It could lead to congestion and sinusitis, which is inflammation and infection of the spaces around the nose area. It can also cause pneumonias, which is severe lung infections, which is actually lower respiratory tract infection once the flu virus settles in down to the lower parts of the lungs. It can also give rise to terrible bacterial infections and the lung infections. It can also cause higher hospitalization rates in the elderly population. It causes 3 to 5 times more chances of heart attacks and 2 to 3 times more chances of stroke in the elderly. Let's now bust a very common myth. I'm going to speak about the fears of the general population and members in the community of getting flu after receiving the flu vaccine. Now, is this true or is this false? The answer is it's false. As I already said, it's a myth. And the reason is the flu vaccine that is administered is an inactivated vaccine. It's an inactivated virus into the vaccine. That means there are no chances of the individual getting the flu after the administration of the flu vaccine. Now, what are the side effects? What are the common side effects that somebody can get? You can get soreness, you can get muscle pain, you can get a mild fever, which is due to the body's immune system fighting against the vaccine. But this is not the flu after the flu vaccine. Why is it important that seniors should receive the flu vaccine every year? Now, the virus, as we all know, the nature of world is change. The only constant thing that we know is change. And so the virus is very notorious, and it changes its genetic makeup every 3 to 6 months. And that's the reason the flu vaccine that we received a year prior might not be the most active, might not have the most active strains of the virus, as the virus has undergone a change. And also the flu vaccine only protects and gives immunity for 3 to 6 months. And that's the reason it's preferred to get administered in early fall, and the immunity should last till January, February. But it's recommended and it's highly advisable to get a flu vaccine every year so that the body has the most advanced genetic makeup of the flu virus to fight against. Early intervention is the most important to actually prevent flu and its complications, and that too with patients who are above 65 years of age and who have comorbidities like diabetes, or who are immunocompromised, or who have cancer, or who have other airway reactive disease like asthma or chronic obstructive pulmonary disease, which is chronic infections or chronic diseases of the lungs. So early intervention, getting oneself the regular flu vaccine every year, right, which contains the latest strains of the virus based on its change that it undergoes because of the mutation power, which is a survival advantage for the virus. So simple techniques like hand washing works, just washing your hands as frequently as you can with soap and water, using alcohol wipes to clean the surfaces which actually could be contaminated, could act as sources to transmit the flu virus. These are basic precautions, covering the mouth if one is sneezing, or being mindful around people who are sick. Let's join hands. Let's fight the flu together. As individuals around elderly population, it is really important to receive the flu vaccine every year. By receiving the flu vaccine, we are actually increasing herd immunity. Herd immunity is a concept where the body has enough antibodies, and so the people around the elderly population are protected from flu and its complications. So let's all join hands together. Let's all be partners in being healthy, happy to keep the blue flu away.